Good morning. Welcome to the Community Voice. I'm Steve Gradick, your host. Delighted to have you with us on this beautiful Monday morning. It's a brand new week, and we're thankful for our sponsor, Tanner Health System, for sponsoring the Community Voice. We invite you to call 678-601-TALK, or you can comment on Facebook Live. We're honored to have in the studio our guest, Marcy Heath of Insurance Solutions.
Good morning.
Good morning. How are you?
I'm good. How are you?
Good. Well, what do you want to talk about today?
We always talk about Obamacare, the Affordable Care Act.
Next year will be our 10th year anniversary of doing this program. Yep. We started before it was made into law, and I think we've been right, as Rush Limbaugh would say, 97.6% of the time.
I'd bump it up.
Bump it up?
Bump it
okay,
up.
99.9% of the time.
That's right.
So it's been a great next year will be our 10th year anniversary. It's been a great 10 years. I've enjoyed you coming in for past decade, although the topic is not our
it's not our favorite.
No, it's not our favorite. All right, I'm going to kind of jump around, so stay with me here.
Okay.
Tell us, open enrollment's coming up in November.
It is.
Before you get started,
okay.
Let me interrupt. Before Obamacare, did we have these open?
We didn't have open
I mean, you could
enrollments.
get insurance at any time.
You could get insurance at any time. It was kind of like car insurance. You could purchase it whenever you needed it. Open enrollment. There was no such thing as open enrollment.
And so with Obamacare, now the federal government is telling us when we can buy or must buy health insurance.
Yes.
Right?
That started, 2013, 2014. So you had an open enrollment window. It was, they kind of bounced it around. The first year it started in October and lasted until I think March. They gave, a larger open enrollment window. Then for the last couple of years, it's been November the 1st through January the 31st. This year, CMS and HHS has shortened it. We have 6 weeks to get everybody enrolled, and it starts November the 1st, but they're cutting it off December 15th.
So this is to encourage them to be part of the exchange, or what's the reason for this?
The reason for this is so that people will be enrolled for January the 1st effective date. So that way, insurance carriers will be able to know what their enrolled numbers will be. So they'll kind of know, I guess, what kind of risk they're looking at for the next benefit year. Because when you have people enrolling after December the 15th and you carry it on out until, like, say, January the 31st, then you have people enrolling, all the way up until January the 31st, and then their plan years start, February and March. So it gives consumers a little more time to enroll.
But before we had enrollment, what happened? We just went and bought it.
You went and bought it, but you also had underwriting. So insurance carriers could look at your medical and they could decide on whether they wanted to take that risk in insuring you or decline you, or you even had insurance carriers that would issue riders on, like if you had a medical condition and they wanted to cover you, but they didn't want to cover that condition, they could rider the condition.
All right. Well, that extensive explanation, tell us about open enrollment. You said starts when?
Starts November the 1st. It will end December the 15th. So again, we have 6 weeks to get everybody enrolled and into a plan for the 2018 benefit period. We only have one insurance carrier for Haralson and Carroll County. It will be Blue Cross and Blue Shield of Georgia. If you look at the state of Georgia, and let's say from like Polk County, and you go all the way across the state of Georgia and go up, Alliant Health Plans is going to have that, the upper state. And then if you look at Haralson County and come down, but exclude like Metro Atlanta, Blue Cross and Blue Shield is basically going to have the rest of Georgia.
So Haralson and Carroll are Blue Cross Blue Shield.
Mm-hmm.
So, but that's our only choice.
That's it. That's all you got. And
that's not a choice when you don't.
no, it's not a choice. And rates are projected to go up 21.4%.
Okay. Now, in terms of what you get with Blue Cross Blue Shield, how many options do you have?
I mean, you have a good many options, but here's my thing from their plans last year is you have maybe like, I don't know, three or four bronze plans. You have 3 or 4 silver plans. You don't have. I don't think you have any platinum plans. If you do, you can't afford them. I think there's like 1 or 2 gold plans. Again, I don't have anybody enrolled in a gold plan because people can't afford them. But here's the thing: is I usually propose the 3 silver options. But the 3 silver options, there's not really a lot of difference from them. So, like with Humana, you had like 2 silver options, but you had a big difference in like the lower silver option, you missed some benefits. And then you gain them by going with a larger silver option. Blue Cross doesn't do that. They have the bottom silver option, which you don't get a specialist copay with it, but then you have the 2, which is supposed to be the richer silver options, and really the only difference is one has a 10% coinsurance and the other has a 25% coinsurance. And one may have a little bit less of a maximum out of pocket by, like, say, $200. So the benefits don't really differ from a lot from one to the other, and from what I have seen over the last year is that the pricing is not really a lot different from one plan to the other. Maybe what, $5, $6. So it's just really strange. And of course, Blue Cross came out in June and stated that they were not going to cover emergency room visits that were not deemed medically a true emergency. So they're scaling back on benefits.
Say that again.
In June, Blue Cross and Blue Shield came out and said we will no longer pay for emergency room visits unless they are deemed a true medical emergency. So take for an example, I'm covered under Blue Cross and Blue Shield because, again, that's our only insurance carrier, and I am having chest pains, and I go to the emergency room thinking that I'm having a heart attack, and they run all these tests, and my end result is I'm having just acid reflux. Well, my end result is I'm having acid reflux, so that emergency room visit and everything that they did will not be covered because my end result is that I'm having acid reflux instead of having a heart attack.
Yeah, and that's determined by the insurance company?
Blue Cross and Blue Shield.
Okay, they determined that.
Mm-hmm.
Okay. We have a question on our Facebook Live thing from J. Scott Robinson. He says if it's like last year's plan, it's an HMO, which doesn't allow any Atlanta hospitals.
That is correct.
Okay, so no Atlanta hospitals.
No.
So just Tanner.
It's just Tanner.
Okay, well, what if you have to be transferred to an Atlanta hospital for a trauma or a unusual procedure that Tanner doesn't cover?
So you have zero coverage because it's out of network.
Okay,
and your plan, Blue Cross and Blue Shield, since it is an HMO, HMOs in the group market is different because you have some HMOs that do offer coverage for out-of-network benefits, but under this HMO product that's covered in the exchange, they do not offer benefits for out-of-network. So if you go to Emory, if you go to Grady, if you go to any of the hospitals that are not covered in your plan, you don't have benefits. So it's just like you're going there and you don't have insurance.
So what do you recommend to your clients?
I have several other options that I'm looking at to propose to my clients this year. I, as a broker, am probably going to insure myself in some other products besides Blue Cross and Blue Shield.
So you would have supplemental products to cover this? situation.
There's some alternative plans out there that you can that you can insure yourself with, and some supplemental products that can offer you just as good as coverage as what is offered through the exchange.
Okay, let's before we get too long, let's go ahead and take a break, and I've got about 1,000 more questions, and our guest this morning is Marcy Sanders Heath of Insurance Solutions, and we're talking about Obamacare, and we'll be back with more after this.
Need help finding something healthy to eat? Tanner Health System has an app for that. Minuit helps you find healthy food options on the go. The smartphone app is powered by Tanner's Health experts, who teamed up with restaurants across West Georgia to make it easier for you to choose healthy food and eat better. Minuit acts like your personal nutrition assistant, showing you the healthiest items on the menu. So when you're not sure what's good to eat, Minuit. You can even use the app to look up recipes and plan healthy meals at home, and modify your options based on nutritional preferences, such as a low-sodium or vegetarian diet. Minuit and Tanner Health System, making it easier to eat healthy and live well. A healthier lifestyle is only a fingertip away. Minuit is free to download on your Apple or Android smartphone. You can download it today by searching Minuit in the App Store or on Google Play. Learn more about Minuit at gethealthylivewell.org.
Good morning. Welcome back to the Community Voice. I'm Steve Gradick, your host. Delighted to have you with us on this beautiful Monday morning. We invite your calls, 678-601-TALK, 678-601-8255, or you can make a comment on our Facebook Live stream this morning. You used the term regarding the gold and the silver plans as being unaffordable, except for maybe 1 or 2 year clients, right?
Mm-hmm.
But this is the Affordable Care Act, right? So not so affordable.
That's not affordable.
Well, that's not the way it was sold to us.
Correct. You know, in 2014, when the exchange came out, it was affordable because this was a whole new era for insurance carriers. So they really didn't know how to price. They really didn't know how to price the plans. So, of course, you had insurance carriers that were kind of underpricing. They didn't know what kind of risk. They were promised by President Obama that they would have the younger to enroll to offset the older, sicker to enroll. Of course, we see now that that didn't happen, and that's probably the one of the major reasons why we're in the situation that we're in. But we did have affordable plans. I mean, I can remember selling plans for the first 2 years to where people had zero premium. I can remember selling plans, the first 2 years to where, people had $20 premiums. But as insurance carriers have found out that they don't have the 18-year-olds, they don't have the 20-year-olds enrolling, so therefore they do have the older population, they do have the sicker population, so therefore they've had to raise the rates. The premium tax credits that come in to offset the premiums is not really bringing that premium down anymore. So people are saying, okay, do I want to pay $600 a month for my health insurance premium, or do I just want to pay the fine? In the end, it's cheaper probably 95% of the time just to pay the fine, especially if you don't have any health insurance, or health conditions,
But the fine's gone up, correct?
Well, it's for 2017, it will remain $695 per person, or 2.5 of your gross annual income. So I was playing with it last night, and I, put myself in at making, $20,000, and it would be $695. But now that's me filing single and no dependents. It would be $695, and that's for a whole year.
Mm-hmm.
And that's having no coverage at all whatsoever. And then I throw me being married and one child, as that's my situation, making $30,000, and I think it was like $1,000, and that's with none of us having coverage. Threw it back in at just me making $120,000 a year, and I think it ended up being a little over $2,000 because then it jumps into the 2.5% of my gross
So
annual
it
income.
started out at $100, and now it's up to
But you look at $695 for a whole year versus I pay $516 a month for my insurance, and I have the lowest silver option, which is a $5,300 deductible.
Mm-hmm.
So I could pay in a year for a fine of what I'm paying a month for insurance.
Yeah, but you have zero when you pay for the fine. You have zero coverage all year long.
Oh, that's true.
I mean, you don't have a $5,300 deductible. You got a $20 zillion deductible.
That's true.
So, but now the rumor is that under this new administration that they're not going to enforce that fine. Have you heard that?
Okay, so that's where a lot of the confusion is coming in, is that, and I have a lot of clients coming in going, well, I'm thinking about just dropping my insurance because, Trump signed the executive order, to alleviate, the burden of the fines and the taxes and, and the penalties. Well, that is true that President Trump did sign the executive order, but at the end of the day, the Affordable Care Act is still the law of the land. The penalties still stand. So basically, what that did was he said, okay, IRS, you guys can look at the where people can. And it's just left me where they can go in and file for an exemption.
Mm-hmm.
Like if somebody can't file taxes because they don't make enough money,
Mm-hmm.
or if they've been in jail, or if they only had 3 months that they weren't covered.
Or if you say you just can't afford it, the fine.
Right. There, like if the premium is more than 8%
Right.
of your, of your income or whatever, like those are the exemptions. That's what President Trump is where that exemption, or is where the exemptions is where he,
Mm-hmm.
So the fine still stands.
It still stands.
It still
if
stands.
you can't snag one of those exemptions.
Then you are going to be penalized.
Yeah, you're sunk.
Yeah, right. So everybody that's under this assumption going, oh, well, I don't have to have health insurance anymore because I'm not going to be penalized, they're going to have a very rude awakening come tax time.
Oh, gee, another piece of good news. Okay. There's about 100 other things. I want to talk about some solutions. But before we go to break, let me ask you this question. I heard you one time speak about how much money the insurance companies are making off of this. If you want to understand this even more fully, you need to understand how much money they're pulling down, correct?
So now let's pull Blue Cross and Blue Shield out of it,
Okay.
because Blue Cross and Blue Shield is the one that is actually like profiting off of this. Okay, Blue Cross, which Anthem is like the parent company of
Right.
Blue Cross and Blue Shield of Georgia, because we know that they own several different Blue Cross and Blue Shields across the United States. They turned a profit of $1 billion in the first quarter of 2017. They acquired
in
the first quarter of 2017. Now they picked up over 220,000 new subscribers in the first quarter of 2017, with Humana pulling out of the exchange. So where where they claim that they're losing money on the exchange is just baffling.
So basically, the reason the insurance company didn't oppose Obamacare was there was a ton of money to be made for them.
Well, you did have Humana. You did have Humana that lost billions of dollars. You did have Aetna, and you did have United Healthcare that lost billions of dollars. That's the reason why they pulled out. But here's my thinking: is the reason why they lost money is because they offered plans they offered good plans. They offered PPO plans. So therefore, you had a really good network. You had really rich benefits. I mean, they had top-notch plans. Blue Cross and Blue Shield is sitting here offering us a HMO plan to where we're kind of stuck, here. We don't have access to doctors in Atlanta. You just kind of have to look at one coverage versus the other. Here they are, they're not even going to pay for emergency room visits anymore. And I do have some other information to kind of tell you about Blue Cross and Blue
If
Shield.
it's not one of their defined emergencies,
Correct.
true emergencies. Okay, we've got more we want to ask and more to go over with Marcy Sanders Heath of Insurance Solutions after this word.
In sports, when you play to win, you get your game on. Shouldn't the same be true when it comes to your health? At Tanner Health System, we're going to help you get your healthy on. Tanner is leading the way for you to eat better, get fit, manage or prevent diabetes, and live tobacco-free, so you and your family can get your healthy on every day. It all starts at gethealthylivewell.org. Check out upcoming healthy living events and join others in the community taking action to live well every day. GetHealthyLiveWell.org. Tanner Health System's way of helping you get your healthy on.
Need motivation and support to eat healthier, become more physically active, or quit tobacco? Tanner offers free classes to help you get your healthy on. Register today by calling 770-214-CARE. That's 770-214-CARE. Learn more at GetHealthyLiveWell.org.
Good morning. Welcome back to Community Voice. I'm Steve Gradick, your host. Delighted to have you with us. Marcy Sanders Heath in studio of Insurance Solutions. We're talking about Obamacare and open enrollment, which begins November 1st. We hear a lot that if Obamacare was fully repealed, that 30 million people would be immediately without health insurance. Is that true or false?
That is false.
Why?
Okay, so budget office expected 21 million on healthcare exchanges in 2016, but only 10 million had registered as of March. Those 10 million members tend to have higher healthcare costs than the average population, overwhelming the narrow healthcare network sold on the exchanges now, as of today. So 21 million was expected on healthcare exchanges, and you only have 10 million. So, and I also want to give you, this right here. Okay, so 2015, we finally have a couple of percentages. We have 46% covered on employer healthcare plans. 6% non-group. We have 19% on Medicaid, 13% on Medicare, 3% on other public, and 14% uninsured. So you have 6% of Americans on non-group, which that means individual insurance. Those are the 6% is the only population
right,
that we're sitting here,
arguing about.
Exactly.
But, with only a couple minutes left, so what is the solution to the so-called America's health care crisis?
So, we talked to Congressman Graves, and
Right.
and I'm in communication with my congressmen and my senators at on the federal and the state level, all the time, and we're pretty much in the same agreement as far as what needs to be done on health care. And you saw that the House put together a bill, passed it,
But they didn't fully repeal it.
no. Senate, of course, can't get their stuff together,
Right.
Obviously. But I really liked what the House put together. I think a full repeal of the bill, but I think that it needs to come back to the states because Georgia knows more about what's going on in Georgia than the federal government knows what's going on in Georgia.
You think?
Exactly. And what needs to happen out in California is not the same thing that needs to happen in Georgia.
You think?
And so I think that we really need to pay attention because it's going to be highly, highly important on who our next insurance commissioner is going to be. Because that's gonna be a driving factor of controlling prices.
Someone needs to get in touch with Insurance Solutions. How should they go about it?
I can be reached at 770-537-5300.
Okay, and you're located in Bremen, but
Yep.
you go everywhere.
Everywhere.
Everywhere,
I'm
anywhere. You're everywhere,
Yeah.
everywhere. Okay, well, when we return, it'll be 2018.
Mm-hmm.
And we is that when we first started this program? I think it was on Obamacare because we
It
hit it.
was.
We hit it before it was passed.
Mm-hmm.
Hit it latter part because it was Christmas Eve when it was passed.
I know.
That's something. All right. Our gratitude to Marcy Sanders Heath for joining us this morning, talking about the open enrollment coming up in November 1st for Obamacare. I have more questions, but we'll just have to wait till next year to tackle those. We thank you for listening, and we thank Tanner Health System for their continued sponsorship of Community Voice. Go out and make it a great day. It's WLBB Carrollton.